gets a chance to have a voice and gets to interact. So please do use the chat to introduce yourself now and say hello and what's your name and where you're from. But also we've got a Jamboard, and we'll share that link in a second in chat. So on that Jamboard, we've got kind of 4 or 5 key questions where we're going to pause throughout this session to give yourself a chance to kind of pause, reflect, and have your thoughts on some of the information that's being shared. So please do use the Jamboard, and the first time we use it, we'll give plenty of time just to kind of navigate that if you've never used Jamboard before, but it is quite straightforward. Hopefully the technology works. Please do stretch and move. So as you're listening in, get up, move around if you need to keep your energy levels up. We do encourage that, and again, we will give time for a quick break halfway through to grab a brew and use the loo. We will be recording the presentations, so just send me a private message if you've got any issues with that. But in order just to make sure we do capture the presentations, in particular from Kath and team, from the evaluation team, just to make sure, so a couple of people who've not been able to attend, that they can look back and watch those presentations. We will be sharing all the slides and information that we go through today, including the Jamboard. We'll keep that live so people can contribute to that, and then we'll provide a summary of the kind of key findings and next steps. But any questions you have in chat as well, we'll try and respond as we go through. Brill. So here we go. So first of all, just to kind of get our heads into why we're here, really, we've developed kind of 3 key messages for Greater Manchester Moving. So just really focusing in on moving matters to all of us, and we know moving matters for a whole host of reasons and benefits. So for physical and mental well-being, but also to kind of create a fairer, greener and more prosperous Greater Manchester and world. So, we're really clear on all the benefits that physical activity has for all of us, and we want that to benefit everyone. But we also recognise that physical activity, moving more, has been designed out of life, and that there's a whole host of influences on why and how people can move. So we do need to design moving more back into everyday life, and we particularly today are focusing on the need to design that into kind of health and care systems in order to support people to move more. And thirdly, kind of recognising that there are 1,000 million influences on our reasons and ability to move more each day, and that is the case for everyone in Greater Manchester. And everyone has an influence on how and why someone moves. So recognising that in our personal lives, but in our professional roles, that we have a role to play and an influence on different people who we come across and the systems and the organisations that we influence. So we're really going to focus on that today. Just reinforcing all those benefits really of moving more and why it has a role to play in health and care particularly. We know that moving more can help in terms of prevention, supporting people in terms of staying well and living well and having the life that people deserve and want, but also it helps with recovery as well. So once someone has a long-term health condition, we know there's a huge benefit for someone to being more physically active to help manage that long-term health condition. And all the other reasons kind of listed there, I'm not going to go into those in detail because with people in the room are definite supportive of that, but just to reinforce that we recognise the role physical activity has on a whole host of agendas and how important it is that we keep the energy and the work in order to support people to be more physically active. And in Greater Manchester, we're seeing real great progress. So just a couple of slides on the data, really, just to kind of share that. So this diagram kind of demonstrates inactivity levels in Greater Manchester. So on that kind of left-hand side before the dotted line shows the time period before COVID, we were seeing a decrease in inactivity, and a decrease that was faster than the national rate. So we were seeing a lot of progress for adults in Greater Manchester. We did see inactivity rise, unfortunately, during the period of kind of lockdown. But after COVID kind of lockdowns, we've seen a recovery that, again, is faster than that national rate. So it's really strong kind of data there to show us that physical activity is increasing in Greater Manchester, which is great to see. And that's kind of shared when we look at children and young people. We're seeing the similar kind of trend, but actually for the first time, we look on that far right, for children and young people in Greater Manchester, levels of inactivity are lower than national rates, which is an interesting statistic to see. So we know there's something going on in Greater Manchester. We're seeing great progress. But having said that, we also don't want to get complacent. There's a whole host of people in Greater Manchester and a percentage of people in Greater Manchester who aren't active or reaching the recommended levels of physical activity, so therefore are not gaining all the benefits that we know are important and that physical activity gives. And that is the case for certain groups. So we've got the data to show that certain groups in Greater Manchester are more likely to be inactive than others, and we want to make sure that activity is available for all, and we want to support everyone to be active. So we know we want to target certain groups in Greater Manchester, and this diagram demonstrates that. So we can look at people from a South Asian ethnicity, for example, or that we know people, if we move on to the next graph, from certain kind of demographic groups are more likely to be inactive. So we need to focus our energy and efforts on that in order to make sure there isn't inequality across Greater Manchester. And it is different for place as well. So across Greater Manchester, we've got 10 boroughs, and activity levels are different in different areas. And then thinking about that kind of inequality focus and making sure that we think about physical activity for certain groups, we recognise from the kind of integrated care system point of view, there are certain target populations as well that have been highlighted as needing that focus and support in order to make sure that health inequality is across Greater Manchester and the nation. So how do we think about the data we've got in terms of physical activity levels and make sure that aligns to the core 20 plus kind of agenda and approach for the NHS, and make sure we're thinking about the pathways and the services and the areas that we want to work with specifically and give that kind of time and resource to targeting. So just to kind of recognise that is in our mind when we're thinking about the data and the insight that we're gaining and the direction we want to go in Greater Manchester. And then I'm just going to pass over to Hayley, who's just going to kind of touch on the framework and Greater Manchester Moving journey so far.
Thanks, Beth. So we're just going to sort our sound. So then we can put the slides back up. So we'll get the slides back up. Just while we're waiting for that, so I'm just going to briefly talk about kind of just where we are at now with GM Moving, but also to reflect back on where we've come from. So the GM Moving in Action strategy that we launched in 2021 is sort of on a page here. So you can see how, excuse me, the mission of Active Lives for All, like let's just talk to you about addressing the inequalities in inactivity levels within Greater Manchester by place and by demographic group is really key. We organised the strategy, and this is a whole system strategy, so it's something that kind of brings us all together with all the roles we play across the whole system. It's got a particular set of priorities and then some key catalysts that enable change to happen at a faster rate. There's some really key principles that underpin the ways of working around GM Moving that are drawn from the public service reform principles and health transformation. Some real underpinning ways of working that we try and, as a system, keep pointing ourselves more and more towards. We've had the benefit of an evaluation team alongside GM Moving and various strands of the work for the last few years, and that's really helping us to understand the enablers for change there, those circles on the right-hand side about how do we create the conditions for change across the whole of Greater Manchester. And in this sense in particular, how do those enablers for change help us in that whole journey of physical activity within health? If you just move us on. The timeline, we've got this timeline that we've just built and built and built, and then we've sort of pulled out some key moments here. So if I go back to sort of the beginning of this journey, you know, we've come a long way working, and there's some people in this room today who've been on this journey longer than I have and have been really pivotal to ensuring that we've got the strategic leadership within the health and care system with real belief and passion and commitment to the role that physical activity and moving can play in health. And you can see along this timeline there some key moments in time around key strategies, around health, around devolution, around GM Moving itself, and then some key moments in time of investment into this work, and some of the things there that Beth mentioned in terms of the impact of the collective work across Greater Manchester to enable us to address inactivity levels at a faster rate than national, and then recover from COVID at a faster rate than national as well. So it's important that we keep reflecting back on where we've come from at this moment in time, and where this piece of work really started was last spring, summer, when the ICP first came into being. A really important time for us to think about, well, what have we done? What are all the different ways that we have tried to integrate physical activity and health over the last sort of 5-6 years? What have we learned about, and where can that take us now? Because the scale of the challenge is enormous, and we need to be, each of us and our organisations and parts of the system need to be ever more effective at creating change and creating the conditions for positive change with people and communities across the region. So this last period, and Kath's going to take us through the learnings, have been about taking stock really, and then sharpening our focus and making sure that we understand the what and the how, where we need to go next on that timeline journey. A part of that, if you just move us on, Beth, part of that is about recognising how GM Moving contributes to, and physical activity contributes to, the whole kind of emerging and continually evolving model around health and care across the region, and that we're very much working to move from a position where physical activity contributes in one layer of the system to noticing that actually, and in this room there are people, if you can start to tune into these diagrams as I move through, and just check yourself, so like, where is your contribution in here, and what role do you play in this model? And where do you kind of locate yourselves? Because someone's already mentioned in the chat earlier that we make one contribution to this work. And so I can see how activity and GM Moving contributes as a relationship in all of these different areas of this model. So what we've been doing in the recent months is recognising that it's not just locating itself in one place, but if we move on, it's about how physical activity and GM Moving contribute across the whole of the health and care system. And this is obviously a really simplified model, and it's a bit hierarchical, and it's a bit, it doesn't, whenever you try and produce a model, it never kind of really full complexity or the scale of what you're talking about. It is a really helpful way to think about what would it be like. Imagine a world where physical activity and moving was designed in and stitched into every single part of the system. And if you think about Greater Manchester and the 10 localities, there's a kind of model within a model here. So there's one of these within every 10, within each of the 10 boroughs as well. So imagine a world where every borough across Greater Manchester, physical activity was contributing in each of these settings and each of these parts of the system. And so what we recognise, if you move on another slide, is also that hierarchical way of looking at it, and the fact that it's even a cake isn't perhaps very helpful in terms of health. So we've been playing around with it and thinking, what is, and you'll get this a bit from where Kath's going to take us through the evaluation, but the real opportunity we've got here, and this is why we kind of turned it into a heart, is to get hearts beating, and to get this work moving, and to get this contribution of lighting up every single part of this system and this model. So that, if I look across this room, I think about the roles that you all play in health and how you are activating physical activity and designing it into your contribution within the health and care system or within the physical activity system. And then today is all about, which is today is all about how do we get more hearts beating for this across the whole 150,000 people who work in the health and care system, 3,000 people who work in our leisure sites. What is it that we can do to get hearts beating in every part of that system, no matter, in every single neighbourhood. So this is still not where it needs to be. I think looking at it, I would flip it around, and I would make more person-centred, and probably the ambulance services and the specialist care would be around the outer layers of this heart, but we're kind of just playing around with it really. So I'd really welcome any thoughts on, how that helps you to think, and what kind of metaphors are most helpful to understand this work. I think that's my last slide. Yeah.
So I'm hoping you can hear me now again. Can you still see the slides, or have they come off? Are they still?
Still see you.
Yeah. Real. So just a chance really now to just pause and think about what's just been heard really, and have a go at using the Jamboard. So I'm hoping the Jamboard link is in chat. Does that need to be put in there? If you can pop it in here, that'd be great. So yeah, just a kind of 5 minutes really, just to have a go at the Jamboard so you can start to navigate that and understand how that works. But just thinking about really what resonates from what you've just heard in terms of the data and the journey so far, and thinking about how moving matters to you and your work really. Have a go at answering those questions in that kind of first page on the Jamboard and navigating that Jamboard, if that's all right, just for a couple of minutes. Shout out if you're not able to access the Jamboard or it doesn't make sense.
Might be worth mentioning the sticky, how you get a sticky link.
Yeah, so if you go to the left-hand side of the Jamboard, you should be able to pick up a sticky note and click on it, and basically you type into that sticky note. You can choose a colour, and then you can save it and moving it around to where you want on the page. And I'm going to stop sharing, Kath, and pass over to you to share your slides when you're ready.
You see that?
Yes.
Yeah.
Just let me know when you want us to start, Beth, and then we'll crack on.
Yeah, so I can see lots going on the Jamboard, so that's great. I think, yeah, you go for it, Kath, while people are still having a go on the Jamboard. That'd be great.
Great, thanks for that. Really good introduction from Hayley and Beth there. So we're really excited to share some of our early findings really from this piece of work, and it's sort of important that we give you some like evaluation aims and overview of what we were doing. But really this piece of work focuses on the sort of key GM moving priority that movement, physical activity and sport play their part through the truly integrated approaches really in health and care. But it's not like a standalone piece. We weren't just coming at this from a blank piece of paper. And there's loads of other work that we've been working on that we want to sort of make sure that you know that we've built on. So there's the GM moving piece that Hayley mentioned before, and all of the local pilot evaluation, the enablers of change are really key. We've done the GM walking ambition and walking city region evaluation and deep dives into a few areas such as the community investment fund, active travel, DWP work, and then the Manchester City and the Four Oaks piece, which was really cool as well in terms of using activity bands to increase physical activity. But there's also the big conversation that the VCSC sector led and to shape the ICS strategy, and then learning from around the country, such as the London Sport Report, the Cheshire and Merseyside New Strategy and the King's Fund. So just trying to say it's not just this standalone piece that we've been working on. Key to this is also, we wanted to build upon this and really get a picture of the landscape and the current system across GM, and consider the who and who are the individuals, what are the roles, what are the sectors that are playing this vital role in influencing the role of movement into the health and social care. So Hayley's blog is vital to that starting piece, and you've all seen that. So it's really good at sort of really doing the exploratory test and learn way of working and just documenting all that in one place. But we wanted to really sort of capture the health and care system structure, and we've done that through a number of ways. I'll show you that in a bit. But rather than just say who's involved, we wanted to really start to think about what are these connections, what's the strength of the relationships, what's the sort of maturity of integration of physical activity into the healthcare system. So this is kind of crucial that we do that, not just say who's involved, but what is it, what does that mean? We want to continue to sort of build the understanding between key ICS, physical activity stakeholders as part of this process, and really see this as an action research piece of work. So, you know, we're testing and learning, we're coming up with these ideas, but it's hopeful that this will help refine programme theories and the work that you're doing. So what sits behind all of this are some high-level programme theories, and just to give you some idea on this, you know, they range from the individual, social environment, organisations and institutions. Then there's physical environment, policy and cultural norms and ideologies. And they're just ways in which we can test what's happening. So understanding what is the context, what needs to happen to change things. So all of this is important, but what we'd say really are the key two at the moment that we're seeing is the cultural norms and ideology and policy areas. So if I just break those two down a little bit, that might help us think about this. So we're talking about a context that may have initially existed, where different institutions, organisations, practitioners, communities maybe had incompatible ideas about the role of physical activity in health and social care. So then this blue arrow is all of you, all of the work you're doing, all the ideas and interventions, projects, processes, policy, everything that's happening to move us to the then and because stages, which hopefully resulting in shared cultural norms, shared solidarity around what physical activity is, why it's important in health, well-being and social care. And then what that will result in is an altered specific view frame of reference. So this is really building this collective identity across organisations, practitioners and communities. And in terms of the policy high-level theory, we're really thinking about an initial landscape where we might have seen actual or perceived insufficient financial human resources putting into physical activity and organisational structures that maybe are not aligned to enable us to do this work. So the work that you're doing, obviously positioned here, and that's what we're trying to locate. And then that will result in, and is resulting in, you know, financial human resources being prioritised to make sure physical activity is there in health policy, coherence, clarity of roles and responsibilities, and physical activity being sort of recognised as a strategic priority, and it's unproblematic politically. So this is because this policy now that mandates it, and negotiation and compromise supports this. So they're the high-level programme theories. But we're really trying to think about everyone here today as spark plugs. It's about the energy, the movement. If we're using this sort of science metaphor, we sort of really wanted to think about people that we hadn't already spoken to, and people who maybe we hadn't seen recently in other sort of activities and health and social care environments that we've been doing. So we spoke to a key group of people who we might want to call, you know, agents of change, spark plugs, trusted transmitters, believers who are embracing this work in physical activity. And we see these people and yourselves all in the room as sort of being able to, you know, embrace these connections, shed the light, beating heart that Beth spoke about, but inspires others to transmit energy and make sure that we've got this network of movement across sectors and communities. So if we think about some science, you know, ideas about momentum, and so, you know, the idea that you've already got, you know, the idea and that it continues to grow unless it's stopped. And so this is what's happening at the moment. Repeated connections through the growth of the expanding relationships is really sort of important. So I think what's important for us to acknowledge is you already had this energy and belief at the start, and we're really seeing this underlying authentic belief that when we're speaking to you, it was very key to everything that you did. So it wasn't that you had to be persuaded that this would be important to your area of work. There was this underlying authentic belief. So this energy is now being sort of harnessed and directed out. So I'm just going to hand over to Charlie. He's going to start to talk about what we did with the interviews and how we sort of came up with some ideas around that.
Yeah, so The actual interviews themselves, I just like to say, were undertaken by us, Substance, and also Greater Sport. We sort of mixed sort of way of doing it. It was a very nice sort of collaborative way of working there. And the actual semi-structured interviews themselves comprised of 24 Sparkplug interviews. And the sort of topics mainly focused around capturing the visions of the GM strategy, the conditions for and the barriers against change, and the key agents of change themselves and the networks around them. We developed a partial account and reflection of the sort of wider GM and social care movement for physical activity integration. Talked about there, as you see, the sort of the Spark Clubs, the Sparkplugs, are individuals like yourself who are key to this work for their agency and their ability to change. Also, their authentic belief in movement for movement, as Kath mentioned there, and the integration of physical activity into the heart of the way that sort of GM health and social care works, acts, and also prescribes to the people in Greater Manchester. So I'm also just going to quickly talk about sort of our coding strategy for these 24 interviews. Obviously, we were left with sort of like a huge amount of data and the information, so we developed a series of themes, sub-themes, and then questions and learnings from this. So theme 1, obviously seen here, is sort of a current Manchester physical activity, health and social landscape, really. And sort of, if you mentioned, I've kind of from left to right, we've kind of got the mindsets and beliefs. So why is physical activity important to individuals personally? Why is it important to embed for others? Then we've also got the strategies and assets of these people. And so what strategies help physical activity across GM system? What have people done to get the message across, and what resources and assets support physical activity across the system? Point 3 is also organizations, individuals, and relationships. So this is really speaking to like, who are these key facilitators? Who are the networks, and what relationships between individuals and organizations are there? Then we got to the conditions for healthcare integration. So that's sort of the political backdrop, the Devolution Act within healthcare, and the sort of the shared vision and principle of that. Then we've also got the barriers, and that's kind of really a very overarching big sort of thing about sort of how can these be overcome, really? Obviously a big question. If you can go to the next slide, please, Kath. So then we also got sort of the second theme, which is what is needed, what is the goal, what is the sort of work towards, and this is basically about sort of actions and what action do people and organizations need to take. So this is all about sort of, as we touched on with Kath's previous slides, around sort of the culture change, narrative change, a belief in a buy-in and authenticity, and a shared vision. What organizations' roles do people need? What who can we get around these tables, and what can GM Moving do to facilitate this? And then finally as well, sort of what other strategies need to be inclusive towards physical activity. So yeah, I'm going to pass over to Johannes just to talk a little bit more about the other methods we used.
Great, thank you, Charlie. So in addition to the themes and the questions we were just talking about, we also asked these spark plugs who basically their spark plugs are. And so what you see here is a partial circuit board, if you want to call it that, a map of spark plugs and their connections. And so the little circles in different colors are the actual people. So some of them we've spoken to, some of them are in the room right now. And then obviously some connections or spark plugs that they mentioned. So those are the circles. The different colors roughly indicate sectors. We're still sort of working on filling the gaps. And the arrows are obviously the connections, meaning that a certain person mentions someone else. So it's important to know, obviously, so it's partial. So we haven't spoken to everyone we wanted to speak. We are trying to reach out to many more. And today is obviously one opportunity for this. And so afterwards, we'll introduce a little survey where we've tried to extend this map further. It's really so, on the one hand, it's for analytical reasons, obviously, to see how are different connections working, how are sectors interrelated, but also it's really an attempt to create connections in the real world. So this is, you know, on the one hand, we want to see how is it looking right now, but the aim is to make this actually happen in the real world, really. And another thing we want to trace is the nature of the connection. So it's nice to know that somebody mentioned someone else and potentially is working with this person, but really we want to know what is actually happening, what is the nature of this work. And the aim there is as well to kind of boost the connections, boost the interrelations, and better supports shared visions, and make the whole systems working sort of more transparent and efficient, and grow the network sustainably after our evaluation work here is done. And it would be nice if you know, the lessons learned would sustainably continue in the future. So as we say, as I just said, we will introduce a survey after, but I think first Kath has another example of this sort of Sparkplug map from the Walking Voice.
Yes, thanks for that. So this one just shows you change over time. So, you know, we did this for the Walking Voice piece, and, you know, it went from 68 members in 2019, the image on the left, to nearly 600 in 2022, is probably more now. So what we saw was a growth in the network, not just the numbers, but the sectors involved, and the types of people. But we're really interested in what are these connections. So we're kind of interested in, you know, who are the catalysts, who are the people there? If there's people who are standalone, why are they? What are the connections that we can build between? What does a relationship look like? Is it a shared resource, a strategy that you work on? Are you in a forum together? What is it? What is this influence? And I think we need to note here, you know, Warren's advice that Hayley cited in her blog around disproportionate influence, and you can't have conversations with everyone in the system. So we understand that. So we understand that the system will grow and will look different as it grows. So what we want to do is see this as a point in time and launch the survey and be able to do this. We did pilot it back in an event in Manchester with the Active Partnerships, and it went down well. We think the methodology works. So we want to get that out there to as many people and sort of look at what the system looks like now and try to then really understand the connections so that we can really see this as a catalyst for the system change. And, you know, further, you know, as Johannes said, enable conversations to happen and make sure that these connections are built upon. So if we think about the survey itself, Charlie's just going to speak to the technicalities of it.
Hi.
Hi.
Yeah. So for the actual survey itself, what we'll be doing is probably putting in a link within this chat, just everyone can have a little go in it. But the main thing it structures around is the agency chart, as you can see here, and it's around potential to integrate physical activity alongside the awareness of and a commitment to. So that's the authentic belief again. And yeah, Kath, pop that into the chat now.
Yeah, great. That'd be good.
Lovely.
I think we're going to have 5 minutes at the end to be able to do this. So the survey is really about locating yourself on this chart, but then letting us know who your key spark plugs are so we can start to build that survey out. And what have we found? So all of this works great, and I want to now just talk about some of the important messages coming out of all of the Sparkplug interviews, which are, you know, hours and hours of really in-depth interviews, a lot of desk-based reading, etc. So first thing is about data and insight, and what you're telling us. Look, there's loads of data out there. There's loads of knowledge that highlights inequality of access to uptake physical activity. So we need to just make sure that we make the most of what we've got. So quotes here saying, go back to the data, maybe there is a commitment to keep investing in that and just make sure that no community is left behind. So let's make sure that we're considering everything we've already got before we're reinventing things. Second thing is about having relatable comms. So making sure that any messaging is co-produced and that the campaign sort of cross-sector, cross-agency, and that it's really community generated. So make sure that the messaging is sort of guilt-free, it's positive rather than saying you should do this, you shouldn't do that. So really sort of reiterating that notion that every small step to change is a huge difference in terms of lifestyle benefits. So a quote there around creating positive stories, positive messages, just reiterating what we've just said. Third thing is about, as we spoke about, spark plugs, community champions, trusted transmitters at all layers of the system, really. So continue to identify these local community champions on the ground and trusted transmitters at, you know, higher levels as well, and make sure that that you're acting as a bit of a conduit, a translator of physical activity messaging in the different systems. So there is a bit of a translation piece there that's really important, and there's a few quotes there. Fourth thing is around signposting, resources and training. So across Greater Manchester and nationally, there is already some fantastic training opportunities, resources available. There's loads of stuff out there. The physical activity clinical champions and moving medicine, etc. So it exists. So it's not necessarily that maybe we need to recreate another suite of resources, but maybe need to just make sure that all the layers of the system have access to them and in the right time, but also that they've got the resource to do and access it. So I think that's the key, you know, actually being embedded in workforce training and making sure it's part of their role to really use it. So quote there around upskilling social care to refer people into physical activity, stuff like that. Lots of learning out there. So yeah, it's time, isn't it, to make sure that people are aware of what's already there. Then we've got strategic leverage across the system. So let's capitalise on GM Moving. It's an established brand for physical activity. Use this more to push and challenge and have challenging discussions at strategic levels to make sure that these priorities are realised within our strategies, really. People saying there, you know, we've got our bit to do, a bit of catching up in strategic terms, having that conversation. So yeah, a bit more work there. Number 6 is around physical activity as being a core priority across health and social care. So help position physical activity as centre stage, really. Make sure that health and social care agendas embody this really, rather than it being an add-on or something that's sort of complementary to a service. So how do we do that? Making sure it's a strategic priority. And people saying, you know, really great to work with GM and make sure that, you know, how do we use things like social prescribing, etc. 7th thing is around a safe space or a community of practice, a bit like today, really. It's a great example, you know, creating a space that enables the narrative for physical activity and integration to be evolving. Make sure that there's a need to maybe disrupt existing systems. How do we do that collectively? And we can create systems that allow us to facilitate and convene conversation and also bridge gaps to make sure that we can start that movement in areas that maybe it's not got the momentum that it has elsewhere. And the 8th thing is building on that authentic, strategic, enabling collective leadership belief. So we really can't reiterate enough that the strategic leaders and spark plugs continue to be this sort of catalysts of this system change, but their own practice is evident. Their own belief in this is really key. So people within the system start to mirror their behaviour and start to copy, you know, ways of working or ways of just being in the workplace. So, you know, promoting that across personal lives and professional lives is really key. So, you know, a key there is about people saying that the ethos of GM Moving work and stems from leadership, the way GM Moving works, and it's been brilliant. Need to keep that going, keep that moving. So some really sort of practical tips that we've got there in terms of what the spark plugs are telling us they think we need to move this piece on in a sort of cohesive way. So on that, we're going to pause, and we really want to grow that system diagram, the spark plug system map, so that we can try and understand the current landscape and then revisit this and, you know, see the growth of it over time, which is going to be really interesting as well. So Charlie's just popped that in the chat, I believe. So if we can just maybe take 10 minutes, Beth, is that 5 minutes to do that?
Yes, I'm going to suggest we maybe go to 10:50, so have 7 minutes to have a go at the survey, but also have a chance to move around and grab a brew if you want to. So I think it's just a couple of minutes, isn't it, Kath, to do the survey?
Yeah.
So yeah, so if we come back at 10:50, if that's all right, so you've just got a chance to please have a go at the survey, but also have a stretch and grab a brew, use the loo, whatever you need to do. That all rhymes. I should be a poet. Okay, welcome back, everyone. Hopefully you've had a chance to do the survey, so a massive thank you for that, and just to thank Kath and team for that presentation, and also for everyone who took part in the interviews to help bring all that together. It's been an amazing thing to read and get our heads into over the last couple of months. So just wanting to now kind of also touch on what's coming out of the kind of conversations and the insight from Substance, but also kind of wider conversations and the ICP strategy that is a draft format at the moment. There are kind of a number of key themes, if you like, or key challenges and opportunities that are definitely coming out as being opportunities for us to integrate physical activity into, or think about physical activity with that lens on. And they're all listed there on the left-hand side. I'm not going to go through every single one, but just to kind of get you to think about really how that resonates with you in terms of, are they the right things? Does that make sense to you in terms of, yes, we should be putting energy and thought and kind of time into thinking about how we support those different areas, and is there anything missing in terms of, from your point of view? And we'll get a chance in the Jamboard to do that in a second. And just, I suppose, yeah, just to reinforce that diagram on the right hand side really is something that's useful for us to think about in terms of when we're thinking about the kind of direction of the work in terms of, from a Greater Manchester Moving priorities perspective. We're using the evaluation, but we're thinking about what's coming from out of the ICP strategy as well, as that kind of forms at a local level. So yeah, the next bit, if it'll let me move on, is just wanted to kind of just get a chance really to hear from the room, and I've prepped Shenny and Beth Mitchell to take a bit of a role in this, but opening it up to the floor really in terms of just listening to what you've heard, particularly from CAF and teams, in terms of those kind of 8 areas of pragmatic solutions, if you like, or support that is coming out as needed. We know that that's already happening across Greater Manchester already. It's building on the strengths and the work that's already happened over the last few years, and just a chance to kind of reflect on that really from your point of view. What is it that is you're recognising in terms of your work that is helping to integrate physical activity? And we will get a chance in the Jamboard to share those examples, but just thought it'd be good to hear from a few different voices really. So I'm just going to ask Shenny first, and then Beth Mitchell, if that's all right, just to kind of give a minute or two about the work that they're doing, just to help bring that to life a little bit. So over to you, Shenny, if you're ready and able.
Thanks, Beth. There is no script, by the way, so this is going to be off the top of my head, so hopefully it will all make sense. So I'm working, I'm based in the NHS Greater Manchester Integrated Care. We've been developing a wellbeing toolkit, primarily started out in response to the pandemic, but one of the first things we were really keen to do is actually create a common definition around what good wellbeing looks like. And so we've got 3 domains that we talk about: physical, psychological and practical, and obviously the physical is a really big part of and has an impact on the other 2 as well, so there's lots of interrelations, and we've got lots of traction around that. My constituents are our health and care workforce, but actually it's much broader than that. It's anyone who's working to reduce health inequalities. So actually we have a workforce of about 180,000, and we know that there are lots of inequities in terms of what their workplace experiences and support is like. So that actually there's a lot of work that's being done from a practical basis, but also around how we shift some of those cultures around what good work looks like, and how we can really help people be at their best and shift some of those boundaries of what work boundaries there are, and then, you know, how we treat people as whole individuals, with the idea it also then cascades into people's lives and communities and all sorts of stuff. There are some really practical things that we're doing. So we run a program of activities that support the toolkit, and our colleagues at GM Moving take a lead role in kind of helping deliver some of that. And as an organisation at the moment, we're trialling and testing what it's going to look like when we're trying to train up some physical activity champions. So we have some wellbeing champions, and then looking at some of the specialisms. So the idea that we've got people in our organisations who are ambassadors for embedding physical activity, alongside those who are working in a flexible way and those who aren't working in a flexible way. So lots and lots of nuances, and really just start making physical activity a day-to-day habit that can create those small incremental shifts, and really start getting a little bit of a sense that this isn't this overwhelming thing that you're not able to kind of participate in if you are not a mud runner running 10Ks every other day, you know, all of that stuff. So really trying to shift some of the cultures. And I'm going to stop there, but hopefully that all made sense. And Beth, I think you're on mute.
Apologies, still not mastered that one after all this time. Can everyone hear me, by the way? Is that... Yeah. Okay. Brilliant. Yeah. So I'm Beth Mitchell, and I'm the Ageing Well Programme Manager within the Greater Manchester Combined Authority in the Ageing Hub. And basically, I'm going to give a bit of an example of some of our work, and probably, I think, in terms of the context of health integration, I think my role very much is solely around that, in terms of shifting sort of an age-friendly model of aging well and thinking about sort of primary prevention and social connections into sort of an NHS model around aging well, which is predominantly more secondary prevention, and how do we bring the two together and align and sort of agree a number of shared outcomes. I think in terms of relation to this and some of the work we've been doing, the Greater Manchester Falls collaborative work is probably the sort of best example in terms of how we're bringing together that multiple layers of the pathway and trying to agree a sort of a common approach, let's say. I think one of the biggest things we've had in terms of you know, what's happened is shifting towards primary prevention as opposed to secondary prevention, and how do we really start to, and obviously physical activity plays a massive role in terms of falls prevention. I think in terms of what's happened in the past, so back within my role at Greater Sport, you know, we recognised in order to do this, there'd been a lot of extensive work in the past, and I know Dave's on the call, Dave Bolger, who was involved in the background of a lot of the falls work at a GM level, and I think what we realised was a lot of what we know and the evidence is there, but actually when it comes to implementing it and creating system change and integrating into that health system is really quite challenging, which I'm sure everyone recognises. And I think sometimes, you know, we need to create the space, capacity and leadership to just do that bringing together and bringing different parts of the pathway. And I think a lot of what, you know, in terms of creating the conditions to do that more effectively, a lot of it is around assessing that pathway. Who are the key stakeholders, that every contact counts, bringing together everyone in the room who plays a role within that agenda, and really co-designing that work together, which is what we've started to do with the collaborative. And I think we've made some real shift to thinking about within health and care, how do we bed the evidence and how do we start to bring all that together. So I think that is fundamentally an example of the way that we're trying to do it, and I think we're making some real good progress in doing so. But I think that's everything from me. Thanks, Beth.
Brilliant. Thanks, Sheni, and thanks, Beth. I did say thank you, Sheni, but I was on mute. But after you spoke, I was trying to pass you on, but Beth jumped in. So yeah, brilliant. Thank you both, because I did put you on a last-minute spot there. It's great to hear those stories and the work that you're doing. Just a chance, really, if there's anyone else in the room, particularly thinking about those pragmatic 8 areas that Kath went through. If there's anything you want to share that kind of resonates in terms of the work and the kind of approaches that you're involved with, put your hand up or just let me know if you'd like to share anything from your point of view. I'll give a couple of seconds for that. And if not, we'll move into the next Jamboard bit. Let me know if I can't see anyone's hand up. Real. So we'll move on. So in the Jamboard, I hope I've just shared the Jamboard. Can everyone see that? Just so everyone can see, we're going to move across. If you go to the top of the Jamboard and click on the arrow at the top of the kind of middle centre of the page and click onto the next question, kind of building on to what Sheni and Beth have been talking about, really, just having an opportunity to think about, from your point of view, the changes and the work that you're kind of involved with, and what you think we need to kind of do more of now going forward. So there's a couple of questions. I'm going to stop sharing and just bring that. We're going to go actually into breakout rooms to do this. So I'm just going to bring up the questions so that everyone can see them. So just bear with me a second. I'm hoping you can see that. So we've got 2 kind of key questions for discussion. So the first one is building on that kind of examples of thinking about where we are now and the conditions that we've got now. But then moving on to the second question and touching on the kind of biggest opportunities and challenges that we have. Are they resonating with you in terms of the things that have come out of the insight and the conversation so far? Or is there anything else that we think we need to do collectively to kind of support, connect and influence to increase physical activity and integrate into health and care? So we're going to have kind of a good amount of time now. We're going to have 15 minutes in breakouts to do that. In each of the room, hopefully you'll have either Kath, Charlie, Johannes, me or Hayley who'll help to kind of facilitate the conversation but really an open discussion. And please do jot down your thoughts and reflections in the Jamboard so we capture that, and then we'll come back to the main room after 15 minutes and each of the kind of facilitators in that room will just give a bit of a summary for a minute on each room in terms of what's been discussed. So we're going to have 15 minutes and we're going to move into breakouts if the technology lets us. Are we ready?